Meniscus tears of the knee are some of the most common orthopedic injuries people suffer and some of the most common surgeries in all of medicine. But does everyone need surgery for a torn meniscus? My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is I'm making it as part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. And so often I get basically comments on my meniscus videos and really lots of different knee injury videos about, hey, I have a meniscus tear, my surgeon says I need surgery, or I have a meniscus tear and he says I don't, or she says I don't need surgery. I don't understand what I'm supposed to do. And that's why I want to talk about it. Meniscus is the C-shaped shock absorber on either side of the knee. If you move the patella out of the way and you see it's the C-shaped shock absorber on either side. It is a very common injury in younger athletes, young adults. It's typically a twisting type of motion, playing sports or exercising. As we get older, you can do it with minor things like picking down to pick up an object. Sometimes you don't even know if you suffered an injury. You don't remember a specific event. All of a sudden you start having pain. Now, the reason that orthopedic surgeons typically say, hey, you need surgery for this, is that on their own, they don't typically heal. The vast majority of meniscus tears occur in a location that don't have a blood supply, and so they don't heal. That doesn't necessarily mean that they need surgery. That's commonly the reason. Now, if it's a younger athlete, teenagers, college, young adults, 20s, 30s, very often it's the type of tear that can be repaired, meaning put stitches in it to sew it back together. And that can be very helpful because you preserve the meniscus. But as we get older and it turns into what we call a degenerative meniscus tear, if that's the type of meniscus tear you have, and this is typically 40 and older, maybe 50 and older, where it may be what we call a posterior horn meniscus tear, and the meniscus is just sort of beaten up. It's not a clean linear tear. Those very often occur in the setting of coexisting arthritis in the knee. And multiple studies over the recent years have shown that surgery is very ineffective for that problem, at relieving pain, at preventing the progression of arthritis, any of that. So not always, but most of the time for these degenerative meniscus tears, especially when they have coexisting knee arthritis, those typically do not need surgery. And so the does it need surgery, does it not, can be tricky. And for your purposes, you potentially don't know, do I have a repairable type of meniscus? Is it more of a degenerative type? MRI can sometimes be helpful at determining that, not always. But typically, the younger you are, the more likely it is that you're going to need surgery for it. Once you get into especially your 50s and beyond, very often surgery may not be beneficial. And so very often we talk about not doing surgery for that meniscus tear. I know it's not a perfectly clean answer and something that you can figure out without going to a doctor. This may be a good reason to go to the doctor, especially if your knee pain is not getting better, but that's a good general way to look at it. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video. You can fill out the contact form to inquire about scheduling an appointment to see me as a patient. I'd also love to hear your experience with your meniscus tear. Leave those in the comments below. Just understand, if you do leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video in this series. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start a live stream, such as my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.